Hello everyone and welcome to PT 668. Today we're going to be talking about putting telehealth into practice. I know many of you probably had some experiences with telehealth either in your clinical internships or maybe as a patient when you've visited your doctor or other healthcare provider. And telehealth is expanding more and more. It's becoming more common in use, so it's really important that we have a good understanding of how it works, particularly behind the scenes. So our objectives today are to describe the APTA's position on telehealth, to be able to describe the California Business and Professions Code position on telehealth, differentiate between telehealth and telephone care, recognize which insurances cover telehealth and which treatment codes are covered, describe how telehealth is billed for various providers, or insurance providers, and then describe ways to effectively implement telehealth into clinical practice. So let's get started. All right, we'll start with the APTA position on telehealth, and I'll just read the slide. It's a well-defined and established method of health services delivery. PTs provide services using telehealth as part of their scope of practice, incorporating elements of patient and client management as needed to enhance patient and client interactions. The APTA supports inclusion of PT services in telehealth policy and regulation on the national and state levels to help society address the growing cost of health services, the disparity in accessibility of health services, and the potential impact of health workforce shortages. The advancement of physical therapy telehealth practice, education and research to enhance the quality and accessibility of PT services, and expansion of broadband access to provide all members of society the opportunity to receive services delivered via electronic means. So really, in a nutshell, after reading all of that, it's really mostly about helping to address the growing cost of health services. And costs can really be saved by offering telehealth services. You don't require the same number of rooms. Visits can be done more quickly. Patients don't have to travel to and from their appointments. And this also ties in with the accessibility of health services. We've talked about this before, that particularly those patients who live in rural areas are often underserved by healthcare. So this gives them an opportunity to receive quality healthcare in a virtual format. It also can help mitigate some of the impacts of health workforce shortages. And again, we see in certain areas of the country, there's just inadequate health care workers to do the job. This really does allow the clinician to see more patients, although it doesn't necessarily mean the care is undermined. And probably one of the big things when we see the APTA position is really supporting the expansion of broadband access. And this is really important. And just as we see there's often fewer healthcare workers in rural areas, also many people in rural areas don't have access to broadband. So this is a big stumbling block or a big obstacle in order to expand telehealth. So oftentimes the people who need telehealth the most because they don't have the physical access to a healthcare provider may not also have that virtual access. So this is why the APTA supports expansion of broadband. So let's take a look. What does the law say? So California Business and Professions Code, section 2290.5. So all licensees under Division 2 of the Business and Professions Code may utilize telehealth methods. So it's as simple as that. So in California, yes, we are allowed to use telehealth to provide care. I want to differentiate the terms telehealth versus telephone. Sometimes they're interchanged, but they are not the same thing. So telehealth services are live, interactive audio and visual transmissions of a provider and patient encounter from one site to another using telecommunications technology. So this may include transmission of real-time telecommunications or those transmitted by store and forward technology. So it's maybe something pre-recorded, perhaps if it's just sharing information or sharing exercises that a patient can do. Telephone is just that. They're considered audio transmissions per the CPT definition. They're not face-to-face evaluation and management because you can't see the patient. And so they are charged or billed a little bit differently. So we know that the APTA supports the use of telehealth. We know that the state of California allows for the use of telehealth, but what about insurance companies? Do they cover telehealth? Well, yeah, and so here are the insurance companies that do cover telehealth. So Medicare, Medicaid, many private insurances, although as with all insurance, you have to check the insurance contract. Everyone's policy is different, so that is something that would need to be checked. So if you have a patient who comes in, let's say with Anthem Blue Cross, you would need to see that, oh yes, their plan is covered, will cover telehealth before you engage them with a telehealth visit. The VA covers telehealth. Indian Health Services do as well. Again, personal injury protection, you want to check the insurance contract. And also workers' compensation will cover the same services as those allowed by Medicare and Medicaid, and the same reimbursement rate as if it were face to face. So you're going to find most of the public insurers will cover telehealth and many of the private ones, but cautionary note, just check with the private insurance with that person's policy. And typically that's not something you will do as a clinician. That's something that the front office or back office staff will do, but they need to know if you're planning to see a patient for telehealth, they're going to need to know to check, oh, is this going to be covered? And then they'll let you know. And if it's not, then you're going to have to do a face-to-face visit, or you just do a visit gratis or free. So what codes are covered by Medicare? So we'll look at Medicare first. So Medicare will cover the evaluation codes. So those 97161 through 97163 are the different tiers or different levels of evaluation. And if we recall, 97164 is the reevaluation code. So those are covered by Medicare. Intervention codes such as therapeutic exercise, neuromuscular re-ed, gait training, and so on. I'm not going to read them all here. And we can see that many of the codes are covered. Keeping in mind certain things will be a little bit more challenging. I mean, an orthotic and prosthetic assessment and fitting, for example, yes, you can't physically do that, but you can see how the patient can fit their own orthotic or prosthetic. You can see them walk with it or do whatever functional tasks with it, and you can make an assessment and give them education on the use of that device. So certain aspects of that code, for example, could be done. Same thing with, for example, neuromuscular re-education. Yes, you can do lots of activities that require coordinated activity for the patient. Certainly you're not going to be able to do something like proprioceptive neuromuscular facilitation, which is hands-on. So you do have to keep that in mind. And you will notice that the codes that aren't covered are things that do require in-person and hands-on. You know, there's no ultrasound code here, or no paraffin, or no electrical stimulation, because of course that can't be done virtually. Looking at Medicaid, so the Medi-Cal managed healthcare plans shall reimburse providers at the same rate, whether a service is provided in person or through telehealth, if the service is the same regardless of the modality of delivery, as determined by the provider's description of the service on the claim. And so pretty much all of the CPT codes that were covered by Medicare will also be covered by Medicaid or Medi-Cal in California. So you can kind of refer back to those various codes. Those are all kind of bundled together. But there are two separate laws and rules because they're two separate entities, and that's why they have their own separate rules. All right, third-party payers. And so I have put an asterisk here, and at the time of writing, these are the big five insurers: Cigna, United Health, Anthem, Blue Cross Blue Shield, and Humana. Most of them will cover for telehealth. Again, you need to check with the individual contract, and those are always subject to change. So the coding for telehealth for the private insurers is going to be different from the coding for Medicare or Medicaid. And we'll see that they still use CPT codes, but the codes are a little bit different. There's telephonic codes and then e-visit codes. So then they will not allow the 9700 series to be used because those are direct patient care, even though Medicare does. So this is where it's a little bit different, a little bit tricky. So for the private payers, they've got their own set of codes. So we'll look at the telephonic codes first. So this is if you have a telephone conversation with the patient, but it is not an e-visit. You don't have the camera up there. And so there's the 98966 through 98968. And so this is if the call lasts 5 to 10 minutes, 11 to 20 minutes, or 21 to 30 minutes, that's what you would bill. And for the e-visit code, again, it's very similar, 98970 to 72. And again, the similar time frame, although with the 98972, it's just greater than 21 minutes. We see with the telephone call, if it's longer than 30, then there would be a combination. You would do two different calls. So let's say, for example, on a telephone call you spoke for 35 minutes, you would do one 98968 code, and then you do one code of 98966. So you have your 30 minutes with the 98968 plus the additional 5 minutes with the 98966. So I hope that makes sense. However, if you were to go longer than 21 minutes, for an e-visit or truly what we call a telehealth code, you just use the one code, the 98972. So you're not getting paid anymore for that. So there are some specific requirements for each of these, and we'll look at the telephonic codes first. So to fulfill medical necessity, the following criteria must be met. The call must be initiated by the established client or their parent guardian if they are a minor. So that means the patient is calling you. The length of the phone call must be documented, as well as the nature of the service and other pertinent information. So you need to be documenting the start and the finish time, as well as the nature of the call. And you would do that anyway because it would be part of a regular documentation. And then the call can't be related to an evaluation management service you performed and reported within the last 7 days. So let's say you perform an evaluation, whether it's through telehealth or whether it's in person. If that patient calls you up 2 days later with some questions regarding that, you can't bill for that. That just becomes part of the normal communication between the healthcare provider and the patient. But if it is something different, if it's something new, if there's a change in status, then that can be billed. So if you did an eval for someone's low back pain, you showed them some exercises, 2 days later they call you up with questions about that, want you to walk through them again, you can't bill for that telephone time because it was related to that evaluation and patient management service that you performed, and that happened to be within the last 7 days. So for billing requirements for the e-visits, or what we call telehealth, it does require an online digital service, and we're going to talk a little bit more about the details and the requirements for that in a short while. This can be for an established patient for up to 7 days, and then the code is based on the cumulative time during that 7 days. So it's a little bit different than the telephone. So if you're spending, if we go back to those codes, if you spend, maybe half an hour with a patient, you're going to bill that half an hour code. And I've forgotten that code. We'll scroll back here again. Let's just, the 98972. I don't remember these off the top of my head. I don't use them as often. The 98972, you would use that within any given 7 days. So whether you saw the patient one time for half an hour, or if you saw them 2 or 3 separate days for half an hour total within that 7 days, you'd actually bill that same amount. So the code is based on the cumulative time during the 7 days. After 7 days, the clock restarts. So that's how you would bill for an e-visit. So a little bit different from the telephone, but there still is this 7-day window there. Now, how do we put telehealth into practice? I've included a link here. I'm not going to go on to that because I've actually provided an outline of what is discussed here. But this is a link to the APTA. and it talks about implementing telehealth practice. So you can probably get a little bit more into the nitty-gritty if you want a little bit more information from the APTA. I'm going to give a general overview so that you'll have a good sense of what is required if you're going to implement telehealth into your practice. So let's take a look at some of the aspects of that. And again, everything that I'm presenting on subsequent slides can be found actually in a little bit more detail, though I'll go into some detail as well, but that can also be found on the APTA website itself by following that link. All right, so some of the first things you need to consider when implementing telehealth is eligibility, compliance, and payment. So you want to check state laws regarding telehealth. Well, we've already determined that California is okay with you providing telehealth. However, if you end up working in another state, you need to ensure that telehealth is allowed. You also want to document the legal and ethical reasons for implementing telehealth, and this needs to be beyond COVID, although that certainly is a reasonable reason to utilize telehealth, certainly for the safety of the patient and the provider. There should also be other reasons why telehealth is beneficial for that patient. And it could be an accessibility issue. It could be any number of reasons why telehealth is most appropriate for that patient. And oftentimes it is an accessibility issue for the patient. You shouldn't be just using telehealth because it is more convenient. So there does need to be a reason that you're at least giving the same standard of care. So just saying, hey, patient doesn't want to drive in, so we're going to do telehealth, or it's more cost effective, that really is an adequate reason. So there does need to be some underlying reason that it's still going to be beneficial to the patient. You want to review the payer policies and ensure compliance. So we've already talked about that. As we've seen, Medicare and Medicaid and pretty much all of the public payers cover telehealth, and they use the CPT codes, although they're obviously the in-person codes are not accepted because you're not doing it in person. For the private payers, they're primarily using either the telephonic or the e-visit codes, but always check. Policies are ever changing, so it's always worth keeping up to date on how telehealth should be billed. Do keep in mind that, whether you work in a hospital or a private clinic or wherever, there's going to be a billing person who's going to really be managing that aspect of it. But there are some things that you're going to have to document and be aware of as you provide telehealth so that the billing staff is able to effectively bill for the telehealth that you've provided. You always want to use secure HIPAA-compliant technology and have business associate agreements with vendors. So you're going to buy a software program. It's not just, hey, let's go on Skype and do this, or WhatsApp or whatever. No, there are HIPAA-compliant technologies specific for telehealth. So your clinic or organization will have purchased one of those technologies, and there'll be a business agreement, and usually that business agreement will typically provide for IT support for troubleshooting, because oftentimes that can be the case as well. So in many times you're not going to be the one making that decision unless you actually are in charge of that. So some of you may end up in management roles and you'll be the ones who are actually making these purchases, or maybe you're going to own your own clinic and you're going to buy a technology. So you do need to be aware that you can't just do a visit via Skype or Zoom or whatever. It has to be HIPAA compliant and specific to healthcare. It's always good to have a legal counsel on retainer. Larger organizations have this, but if you decide you want to open your own practice, you're going to want to have a lawyer, and then you're going to need to, and someone who is well versed in healthcare law, and make sure this person is going to be able to answer questions for you or help you out if legal issues arise with telehealth. And then finally, check your malpractice insurance for policies related to telehealth. Are there any exclusions to that? Insurance companies are notorious for putting things in the small print, and certain things are excluded from coverage. So just make sure that telehealth is covered, and if not, you want to contact the insurance provider and make sure that telehealth will be covered. Some practice considerations. So when you're implementing telehealth, you want to determine the patient, the provider, and the technology needs. So that's very vague and general. So the patient need, why do they actually need telehealth? We've already touched on a couple of issues before in terms of you documenting the necessity, and it may be they have COVID or some illness and they can't come in. There may be accessibility issues. They're unable to drive. They don't have transportation or whatever. That might be a reason why. It could also be that, hey, we have a patient who is, we're following up with some exercises. They don't need a lot of hands-on care. It does make more sense for them. We can do a video visit, go through the exercises. We can get the same benefit from doing telehealth as if the patient were to come into the visit, because we're not having to do a lot of hands-on care. There's not any modalities or things like that needed. Also, consider for yourself, the provider. Does telehealth work for you as a practice? How are you going to schedule that? Do you have a certain time of the day blocked out for telehealth, or is it just as needed? How do you determine which patients are going to need telehealth? So it's important to have policies in place that help you consider when it's appropriate to provide telehealth. And you're also going to consider some of the technology needs, and we're going to go into those in a little bit more detail. You want to consider patient demographics and barriers to successful telehealth visits. So some of the demographics can be, again, are they in an area where there's not adequate broadband? They can't do a live stream video? Is language an issue? If you want to do healthcare in their home, you want to have them do exercises. Can they do that in a safe place in their home? Also, where you can see them do that. What's the lighting like? Do they have supervision if there's a fall risk? And then you might determine maybe it's not even appropriate that you're doing telehealth. So those are some of the things you need to consider. Is the person technologically savvy? You get a lot of patients who really are very uncomfortable using a computer just in general, but particularly for something like a telehealth visit. So all of those things you need to consider before you recommend a telehealth visit for a patient. You also then need to determine which interventions are feasible and appropriate and safe. I talked about before, can they do certain exercises in their living room if that's where you're going to be seeing them, or is there too much clutter in the way? Is there a fall risk? And are there certain things that they're just able or not able to do? Do they have appropriate equipment? If you have them doing a whole bunch of exercises on the equipment in the PT gym, well, they're not going to be able to reproduce that at home. And it may be that you have to modify, and we've talked about how to do that in therapeutic exercise, but you do need to consider that. Is this just going to be a wasted visit if we can't really do any of the interventions we would like because there's too many barriers in the way? You also want to develop a business plan for telehealth. You want to consider, well, how much revenue am I going to generate? How many patients are going to need telehealth? Which of the providers in the practice will be providing telehealth? Is it going to be all of them, or is it just some of them? How much time is set aside? What are the costs for getting all of the technology in place? Is it going to be done in the clinic, or are you going to be doing it from your own home? So these are a number of things you have to consider, and it's not a free intervention, and you may find that maybe the reimbursement isn't adequate to cover the costs of doing telehealth. So a detailed business plan is necessary. And of course, you want to track patient outcomes following telehealth. Certainly from the business standpoint, you want to track, are you generating the revenue that's needed, but you also want to see, are the patients getting better? And certainly you can compare that to the patients who are coming in person. And if you're finding that the patients who are doing telehealth are not as successful, you may need to reconsider, well, how is this telehealth being implemented? Ultimately, you may need to scrap it, but it may just need some modification. And then with everything, you should be surveying your patients. This is a good idea in general. Every time I go see my doctor, I get a survey. I have to admit, I don't always reply, and I know the surveys are important. And if you get 10% of survey respondents, you're doing pretty well. But it's important to survey people, get the feedback, and even that sometimes can be done in person, but an anonymous survey is always the most accurate. All right, I mentioned we would talk about some of the technology considerations. So probably one of the most important things, as I said, you're going to be getting a software for telehealth, or maybe you start at a place that already has that in place. Again, it's not Skype or Zoom or WhatsApp or whatever. It's going to be telehealth specific software, and it's important that you are well versed and adept at using that technology before you actually treat a patient. So practice, 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 and learn to troubleshoot, because as we all know, we always run into technological issues. I mean, even online classes, we run into technological issues many times. And you don't want that to disrupt your practice. So as much as you can, practice and become well versed in the use of that technology. You're going to need the largest bandwidth possible. Also, you have to consider, is it just going to be one person or one provider at a time doing telehealth? Or are you going to have multiple providers doing telehealth in your facility? That's going to eat up a lot of bandwidth. So this also, you also might need to consider, if you only have one software, you have limited program on a computer, or if you only have limited bandwidth, you may have to stagger when those telehealth appointments are scheduled. You want to create an IT development, installation, and support plan. So who's going to be developing this, who's going to be installing it, and what happens when things go south? Because invariably, there's going to be IT issues. I've never worked at any job where there hasn't been an IT issue at some point. Do you have a support plan in place? Who's there to help you out? You're probably not going to be able to call the Geek Squad. As I said, many of these software programs with the licensing agreement, they may have bundled with them some IT support. So make sure that's in place. You want to make sure you have the best surroundings to conduct telehealth visit. Is it a soundproof room? If you're in a room or an office and people can hear you, well, that violates HIPAA law. Or you can't be doing it in a shared office with all of the other PTs who are coming in and out. What's the lighting like? Do you need to be out in the gym doing demonstrations for this patient? So there's a lot of things to consider. Is it in terms of getting the best surrounding? I've had some telehealth visits where I know one of my doctors, I'm sure he was at home. It looked like he was at his home office. That was fine because it was just a consult. But you also need to make sure that's a secure environment as well. You need to have a disaster or adverse event plan. So the adverse event can really be, if the technology breaks down, what will you do? Is there a way to reconnect with that patient? But also a disaster plan too. What happens if there's an emergency? Is there someone else that you can contact? And we're going to talk about some other things too, making sure you have all the appropriate contact information and even backup contact for these patients if they're at home. So something could go wrong while you're working with the patient. They have a stroke, a heart attack, a fall, whatever. You need to have a plan in place. How are you going to use technology to help you overcome that emergency or disaster situation? And then it's also useful to maintain a hybrid approach of telehealth and in-person visits. You don't want to solely rely on telehealth. Even if the patient feels it might be most convenient for them and they like it, you still need to have the patient come in on a periodic basis for checkups, to do reevaluations, and so on. And this is important that you share this with the patient ahead of time. Yes, we're going to do some telehealth visits, but every third or every fourth visit or what have you, I need you to come back in and see me. And so that has to be part of the treatment plan. All right. You're also going to need to create some policies and procedures. These should be well documented so everyone in the facility is aware of how telehealth will operate. And most important, you need to follow them. So one of the things you need to do is establish patient residency. If they're out of state, does your license cover treatment for you to treat them out of state? Or are there going to be issues with the insurance if they're out of state? So this is something that every patient, their residency should be established. And if they are in a region or a different state, you need to check that that's going to be okay. Part of your P&P should be familiarity with state laws. So some states, does an in-person relationship need to exist prior to telehealth visits? It doesn't state that in California, but other states may require there is an in-person relationship. So you've seen that patient in the office before you begin telehealth visits. So if you go to another state, check on that. You need to ensure the same standard of care as for in-person visits. This is vitally important. Telehealth should not be considered second tier or second level treatment. It should be at the same level as in-person visits. It's just administered in a different format. So the quality of care should be the same. If you can't offer the same standard of care, then you shouldn't do a telehealth visit. And so you need to be aware of that. If that care cannot be offered at the same level, at the same standard, then you're going to have to discontinue telehealth visits and bring that person into the clinic. So you need to be honest with yourself about that. You also need to ensure informed consent. So this is prior to doing the telehealth visit, that the patient agrees to that. At the beginning of the visit, describing procedures, and then even as you go along, describing each intervention. It's really helpful to have this verbal acknowledgement. With telehealth, we sometimes take things for granted when we see the patient in person, but every step of the way you should be getting consent. You also need to ensure, if you're treating a pediatric patient, anyone under 18, there is a parent or guardian present. They should be present the entire time. They don't necessarily have to be on the screen, but you have to be able to communicate with them and acknowledge them. It's useful to have the patient demographics, so you want to know where they are, emergency phone number to get in touch with them, also a backup number if something happens, even understanding, their language barriers, things like that. All of these things are important for the safety of the patient. And then it's useful to have a local PT available for consult or backup, particularly if that person is far away. Now, it may be that you are the local PT, and that's fine. But if you are treating a patient who's on the other end of the state, it's useful to have someone available for consult or backup so that they can see them in person, and they can even also be kind of a default emergency backup. So, more policies and procedures. When you begin treating the patient, or actually before you even begin telehealth, you need to explain the technology that you're using. So this can be either, if you're seeing the patient in person first, you can explain, hey, here's the software platform we're going to use. We're going to send you a link to this, or it can be done via email. But in some way, that patient needs to have this information ahead of time. They need to know the software that you're using. They need to know how to log in. They need to know what's going to happen, and I've had mixed experiences with this myself. I've been a patient where everything was very formal. Here's a login. Here's what's going to happen. You're going to be in the waiting room. The physician will come and see you. I had another one where it's like, I didn't get the code to log in. I had to call the office. Oh yeah, we'll text you right when the doctor's ready with a code. It's like, well, you never explained that to me. Or if you did, it wasn't obviously apparent. So it's important that the patient is given as much information about how that technology will be utilized, what they should expect when they're logging in, and how the visit will go. You really can't explain that too much to them, because a lot of patients, even me, I struggle with it because I wasn't clear on the format with one of my physicians. When you start the visit, particularly if it's the first time seeing a patient, you want to introduce yourself as well as any other providers who might be in the room, and you want to share your credentials. And typically this is done by explaining who you are. I'm a physical therapist, and actually having your name badge. Remember, in the clinical setting, you have to wear your name badge, so you should wear that, or at least, actually even better yet, hold it up to the screen so that the patient is aware that you are actually who you say you are. Also, before you start the visit, explain that the patient can ask questions at any time. This is, for many patients, an unusual experience. Some of them have experience with telehealth, but for many of them, it'll be their first time. So you want to comfort them and let them know that at any time they can interrupt you, ask questions, because it may not be the type of visit that they are used to. Visits aren't typically recorded, and it's important that you explain to the patient that the visit will not be recorded. If the patient wishes for the visit to be recorded, then you need to obtain written consent beforehand. So this should be discussed prior to the visit, not at the start of the visit, but prior to, ahead of time. And this could be part of the instructions, even explaining the technology. Hey, we're not recording this. If you wish it to be recorded, hey, we're going to send you this form. You can sign it and email it back to us. And if they don't, then you won't record it. You also want to explain any technical difficulties, both potential and in real time. So certainly, hey, there's a chance that the call, the the e-visit may be cut off. Here's our plan in place if that happens. It could be a callback, maybe a reschedule, or what have you. Sometimes it happens in real time. Hey, I can't see you or I can't hear you. Maybe you have to hold up something, but it's important that you're explaining any technical difficulties and that you have a plan in place for when those technical difficulties arise. So you just don't want to be winging it. So you need a plan in place for what if the call gets dropped? What if you lose video contact, audio contact, what have you? And also, it's important that you explain to the patient that they may need to be seen in person based upon your clinical judgment. If you find that you can't offer the standard of care, we talked about that before, if you can't offer that standard of care that's equivalent to an in-person visit, then you're going to need to see them in person. Likewise, you may find that, the complexity of this patient is going to require an in-person visit, or if their status has changed, you need to do a reevaluation and you don't feel that you can do a comprehensive reevaluation via telehealth, then you need to see them in person. So you always need to let the patient know that at any time, hey, I may not feel comfortable continuing telehealth. I may need to have you come into the clinic. It's important that the patient knows that. And it's important that you feel comfortable with your decision with that. If you're not sure, bring them in person. It's better to be safe than sorry. All right, more P&P continued. You need to document start and stop times. We talked about that before, particularly with the telephone, but also for an e-visit. So you need to know how much time you're spending with that patient so you can bill appropriately. It's also appropriate just for defensible documentation anyway. You want to document your location, the patient's location, as well as the location of any ancillary providers. Do you have a PTA working with you? You even have an aide doing some other stuff, maybe getting some documents for you, whatever it might be. But typically it's just going to be you and the patient for the most part, but you want to document both of your locations. You want to provide the patient with follow-up instructions for the next visit. And because everything is done as an e-visit, it's great, send them an email. Many clinics or many healthcare providers have a patient portal. Let them know, hey, I'm going to send you some instructions. You can find these on the patient portal. If it's a smaller practice that doesn't have a portal set up, again, you can email the patient with anything that they might need. Any emergency procedures should be well delineated. So this is something you need to think about. There's a chance that a patient, they have a stroke, a heart attack, they get injured while you're treating them. What if they're alone? What do you do? It's very different when you're in the clinical setting. You're right there. You're not able to administer first aid when it's an e-visit. Who's going to call 911 if that's needed? So you really need to go through and look at a number of emergency procedures and make sure everyone's role is clearly defined. And then documentation for e-visits must be consistent with standards for in-person care. That should be no surprise. Your documentation must be defensible. It's used for billing, but it's also used to defend yourself that you provided a care that meets the standard of the profession, as well as for the next visit or someone else who's seen that patient, they will be able to continue with that care based upon your documentation. All right. So if you've decided that you're going to do telehealth and now you know all the things that you need to do, well, now you need to market it as well. You thought you were done with all the marketing. Nah, not yet. So of course, before you start treating patients with telehealth, you need to determine what type of conditions you'd like to treat. You're not going to say telehealth available for all. There's certain conditions that wouldn't be appropriate. Maybe you have an outpatient clinic, but you're still seeing patients post CVA. Maybe these patients wouldn't be appropriate if they have balance issues or coordination issues. So there may be, you want to perhaps identify, at least for marketing purposes, the types of conditions that you think would be best to treat. And then decide what type of media platforms you'd like to use to market. This is no different than any other marketing. Are you going to send out emails? Do you advertise in journals, paper, online, whatever? Are you doing door-to-door? Are you letting the physicians know? And I talk about that a little later as well. You want to develop a marketing budget. How much money are you going to spend to market this? And this should be for any type of marketing. And then it's useful to email existing patients telling them about that you're offering telehealth services, and you can provide them with a lot more detail about what that involves. Or certainly you can let them know in person if you have a patient who you think would be appropriate for telehealth. Hey, you're driving in half an hour every day or every a few times a week to see me. I'm looking at you. We're not doing a lot of hands-on. I think a lot of stuff we could do progressing your exercises at home. Maybe telehealth is for you. So you can let that patient know. Additionally, you can let the physicians know that you offer telehealth services. That might be great to even drum up more referrals. More marketing. So you do want to stress the clinical value and convenience of telehealth. We often think about telehealth in terms of convenience. I know it's convenient for me, and I think for most patients, they're going to like it for the convenience, but we also need to stress the clinical value as well. It may be that, hey, because it's convenient, we can get you in for more visits because you don't have to take off as much time from work. You don't have to drive to the appointment. So we can actually see you more and monitor your progress a little bit better. That's just one example of a way that there's great clinical value. But you also need to stress that having the patients participate in telehealth visits does not mean, again, it's a second tier type of treatment. It is of the same quality, but you certainly need to let them know there are certain treatments you can't do. Obviously, you're not going to be able to do any hands-on treatment or any modalities or things like that. You want to map out the telehealth process for your patients. And again, this kind of gets back to explaining the technology. Let them know from a technological standpoint what to expect, but also what it means from a clinical or from a treatment standpoint. As I mentioned, you shouldn't be seeing your patients entirely via telehealth. Hey, we're going to be doing a few telehealth visits, and then every couple of weeks I'd like you to come back into the clinic for a reevaluation. I want to see you in person. So there should be a clear map of what the patient should expect, and they should know what to expect when they start participating in telehealth. You want to provide that information about the technology to the patients. I've talked about that already, but this is also part of your marketing as well. But in this case, you also want to emphasize, hey, it's quite easy to use. Hey, if you've used an email, it's quite easy. You just log in. If you have a camera on your computer, all those sorts of things you can describe the technology and maybe even go through it with a patient in the clinic so they can see what that looks like if they're not particularly tech savvy. You want to provide the available telehealth hours, and oftentimes providers will have certain hours set aside for telehealth and certain hours set aside for in-person. It would be hard to jump back and forth. If you get behind on your in-person visits, which is quite easy to do, then you've got all these people in telehealth waiting. So it's typically, maybe early in the morning or right after lunch when you can kind of start fresh. You can start with those telehealth patients. You want to provide them with your contact information, particularly if they have any questions about telehealth. And then you want to track the efficacy of your marketing efforts. So you want to see, we've made all these efforts, we've advertised, we've done word of mouth, we sent email. Well, what's happening? Are we getting a lot of patients signing up for telehealth, or is it stagnating? And if you're not getting as many as you would think, you might need to revamp some of your marketing efforts. All right, well, that is it for telehealth. I've included some references here for you, and certainly if you have any questions, I look forward to hearing about them in class. You can always email me, but many of the questions may be better shared with the rest of the class, and hopefully we'll have a great discussion about telehealth when we get together. Thanks for listening and watching. Have a great day. See you in class. Bye.